Hi and welcome back. Today we're going to be talking about everybody's favorite topic, UTI or urinary tract infection, also known as bladder infection. It's a very common issue that we see in the outpatient setting and is usually very easy to treat. This segment is going to be about acute, uncomplicated UTIs in non-pregnant women. There are special populations. They're treated a bit differently than what we're going to discuss today. This is just an otherwise healthy person who has a random one-off UTI. What happens in a UTI is that bacteria builds up around the urethra or the urinary opening and then ascends into the bladder. It causes a great deal of discomfort, and most of the time people experience what we call urgency or feeling like they need to go right away. Frequency, feeling like they need to go very often. A sense of incomplete emptying of the bladder. Sometimes we'll even see blood in the urine. Then we get to call it acute hemorrhagic cystitis, which sounds way scarier, but it just means you have a urinary infection and now you're peeing blood along with it. Don't be too alarmed. It's probably nothing more than just inflammation.
Everybody stay calm!
What's the procedure, everyone? What's the procedure?
Stay calm!
Wait.
Many people will have what we call suprapubic pain or pain very low in the pelvis, also pain during and or after urination. UTI is much more common in women because the distance of the urethra to the outside world is shorter in women than it is in men. Also, in men, we have to consider the prostate when we are diagnosing this issue. So, if you are a man who has underlying prostate issues or suspect that you might, the workup may be a little bit different than a simple, uncomplicated urinary tract infection. Risk factors for UTI. There are many. One is pregnancy, underlying diseases such as diabetes or autoimmune conditions, constipation, people who have been on long road trips or airplane rides, they don't tend to drink enough water and don't tend to go as often as they should. I also see them pretty frequently in healthcare workers or teachers because these people don't like to take potty breaks either.
Can I use your bathroom?
No, you may not. Bathroom is for paying customers only.
If you think you may have a urinary bladder infection, when you go to the doctor, they're going to want you to give a urine specimen. It's important when you do this, they have little towelettes that they will give you so that you can clean around the urethral opening so that you can decrease the amount of skin contamination bacteria that may be collected along with what's growing in your bladder. They also like you to catch a midstream specimen, meaning you go a little bit, stop, then go in the little container, and then stop, and then finish up. It doesn't have to be a huge volume of urine for the urinalysis, but you need to at least go prepared to leave a specimen. Don't potty right before you leave the house because they're going to want to see a specimen. Even if you've tested it with one of the over-the-counter testing strips, many of us like to collect a urine culture. That is where you take the urinalysis and then send it to the lab so that they can put it in an area where they grow out the bacteria that's in there in a petri dish. And then once they identify that, they can test it against little antibiotic-infused discs to see which antibiotic it is going to respond nicely to. It comes back to us saying either sensitive, intermediate, or resistant. And there is a great deal of antibiotic resistance with urinary pathogens or bacteria these days. So many times, if it is someone who I'm concerned they may have a resistant bacteria, I like to go ahead and run the culture before we ever start antibiotics. That way, if they're not getting better, we'll have the answer. In a perfect world, we would be able to get a culture, but it takes 48 hours before we start antibiotics. So much of the time, what I do in my practice is I have someone come and leave the specimen, and I will start them on an antibiotic presumptively. Once we have the urinalysis, which only takes a minute or two to run, we can say, okay, you have an infection, choose the antibiotic, and then change it when the culture is back in 48 hours. The usual antibiotics that we pick for urinary tract infections are sulfamethoxazole trimethoprim, aka Bactrim, much easier to say. Nitrofurantoin, which is also known as macrodantin or macrobid, or ciprofloxacin, shorter name is Cipro. We try to reserve medicines like Cipro and other fluoroquinolone antibiotics for last resort because they have a higher risk of side effects and can sometimes make people really have muscle aches and soreness. But also, we're getting a lot of urinary pathogen resistance to the other antibiotics, so we don't want to go straight to the big guns if we don't have to. There's also another medicine called fosfomycin that is a one-dose antibiotic. I haven't seen it used as much in my area of the country. It's just not one that is thought of, I think, first round. For people who are allergic to any of those antibiotics, we also might use penicillin in certain cases. Certainly, some people grow out strep in their urine culture and then it's appropriate. Also, the class of cephalosporin antibiotics can sometimes be used if necessary. Most simple, uncomplicated urinary infections only require 3 to 5 days of antibiotics. Most people feel like we need to be taking antibiotics for 7 to 10 days, but that's actually not the case in these infections. Usually people get better very quickly. So when we're choosing an antibiotic, first line is usually going to be Bactrim or nitrofurantoin macrobid. If someone has had an antibiotic in the last 90 days, usually we will go more for Cipro or one of the other antibiotics because there's a greater likelihood that that person has a resistant bacteria. Sometimes we look back if someone has a recent culture and we will choose the antibiotic that that bacteria was susceptible to. It comes in a list and there usually are several things on that list. Just pick from one of those and also look at what the person may or may not be allergic to and the other medicines that they're taking, and that helps us in our decision process. So other than antibiotics, what can we use to help manage the symptoms? There are things we can buy over the counter like Pyridium, also known as Azo. There are some cranberry products. People say that they can help keep bacteria from clinging to the inside of the bladder wall. If you want to try that, great. If you like drinking cranberry juice, fantastic. It really needs to be some pretty strong cranberry juice to have enough cranberry in it to get the benefit, but the concentrated pills typically work fairly well. There's also methenamine and methylene blue that can be used. So drink lots of water. Void, which means pee, often, and don't hold it when you need to go. Stay tuned. In my next couple of videos, I'm going to be talking about pyelonephritis, aka kidney infection, and then we'll be covering the topic of recurrent UTIs. Don't forget to like and subscribe.